Hi, in this video I'll explain Osgood-Schlatter disease, what it is, how it is assessed and how physiotherapy can help. We'll focus on clear advice, hands-on treatment where appropriate and progressive exercise rehabilitation to restore capacity and confidence. Osgood-Schlatter disease causes pain and sensitivity at the tibial tubercle, the bony area below the kneecap where the patella tendon attaches. It occurs while this growth area is still developing, particularly during periods of rapid growth and high running or jumping loads. A bump may become visible and can remain after the symptoms have settled. The condition is not dangerous, but it can significantly affect sport and everyday activity. Pain is usually localized over the bony bump below the kneecap and is commonly aggravated by running, jumping, squatting, kicking, and kneeling directly on the lump. Symptoms often flare when training volume increases or during a growth spurt. Either one or both knees may be affected. Pain will normally improve when the aggravating load is reduced. However, complete rest can result in lost strength and make returning to sport more difficult. Osgood-Schlatter disease is usually diagnosed clinically without needing a scan. We ask about recent growth, sports participation, sudden increases in training, and how the symptoms behave during and after activity. The examination looks for tenderness over the tibial tubercle and assesses movement, strength throughout the knee, hip, and calf. We may also assess squatting, jumping, landing, and other sport-specific movements. Imaging is not routinely required, but it may be considered after unusual trauma, when symptoms are atypical, or when recovery isn't following the expected path. Physiotherapy creates a realistic management plan with the child, their family, and when helpful, their coach. We may temporarily reduce or modify the activities producing the greatest reaction while maintaining tolerable movement, fitness, and sports participation. Pain during activity and the response later that day or the following morning helps us decide on the appropriate amount of exercise. Manual or hands-on therapy may include soft tissue treatment for the quadriceps, mobilization of the hip, knee, or ankle when stiffness is affecting movement. This can improve comfort and movement. It does not replace progressive strengthening. Rehabilitation may begin with isometric knee extension exercises and comfortable functional movements. Strength is then gradually progressed using exercises such as squats, step-ups, and other resistance exercises for the hip, knee, and calf. Once basic strength is improved and symptoms are manageable, running, jumping, and landing are progressively reintroduced before returning to full training and competition. Research has found that a structured 12-week program involving activity modification, pain monitoring, strengthening, and graded return to sport can improve pain, strength, and jumping ability. A patella tendon strap, kneeling pad, footwear adjustments, or ice may provide short-term symptom relief. These options are not essential for every child and don't improve strength or physical capacity by themselves. Training schedules, playing surfaces, recovery, and growth-related changes can all influence symptoms. Stretching may be included when there is a meaningful restriction, but aggressive stretching into pain is not necessary. Osgood-Schlatter disease is described as self-limiting because the sensitive growth area eventually matures. However, symptoms can persist for many months and occasionally longer. Simply telling a child to stop everything and wait isn't always helpful, particularly if they begin losing strength, fitness, confidence, and enjoyment of sport. A structured physiotherapy plan can reduce symptoms, build physical capacity, and maintain participation while growth continues. The bony bump may remain after the pain has completely resolved, and this is not usually a problem.